irregular flutter that had become my constant companion. 28 years old and my heart was failing. Not dramatically, not with the theatrical collapse my family seemed to think qualified as a real medical emergency, but steadily, quietly, the way a light dims before the bulb burns out completely. "Emma, we need to talk about Thanksgiving," my mother said over the phone, her voice carrying that particular tone of forced patience she reserved for inconvenient conversations. "Your cousin Jessica is announcing her engagement. Her fiancé's family will be there. Very important people. His father is on the hospital board with your Aunt Marie." "I'll be there," I said, adjusting my medication organizer. 3 weeks post-surgical consultation. 6 months on the transplant waiting list. My cardiologist had been clear. I was lucky my condition was caught when it was. Lucky I was young enough and otherwise healthy enough to be a good candidate. Lucky. "The thing is," Mom continued, "Marie mentioned you've been talking about some kind of surgery? At Thanksgiving dinner? Emma, honey, we need this to be about Jessica. She's finally settling down with a successful man. Can you just not mention medical stuff? It makes everyone uncomfortable." I stared at my pill organizer. 4 different medications to keep my failing heart functioning while I waited for a transplant. Not mention it. You know how you get. Everything becomes about you and your issues. Marie says half the things you worry about are probably anxiety anyway. She should know. She runs an entire emergency department. Aunt Marie, Director of Emergency Services at Metropolitan Hospital. The family's medical authority, the one whose opinion shut down all other opinions. The one who told me at last year's Thanksgiving that I looked fine and should stop seeking attention. "I have dilated cardiomyopathy, Mom. I'm on the transplant list." See, this is exactly what I mean. All these big medical terms to make everything sound dramatic. "Marie checked your records. She has access to everything at Metro. She said your condition is being managed with medication. The surgery you keep mentioning is optional." So, my heart transplant was optional. Just come to dinner, be pleasant, and let Jessica have her moment. Can you do that for your cousin? I could have fought. Could have explained again that managed with medication meant kept alive while waiting for a donor heart. Could have detailed the fatigue, the breathlessness, the knowledge that my current heart was going to kill me without intervention. Instead I said, "I'll be there." Because somewhere in the chaos of cardiology appointments and insurance authorizations and transplant coordinator meetings, I'd stopped expecting my family to understand. They saw me at dinners, carefully managed on medication, looking relatively normal. They didn't see the 3 a.m. panic when my heart rhythm went chaotic. They didn't see the conversations about mortality statistics and post-transplant survival rates. They saw Aunt Marie, confident and authoritative in her scrubs, telling them I was fine. Thanksgiving arrived with the sharp cold of late November. My mother's house blazed with warm light, the scent of turkey and stuffing greeting guests at the door. I'd taken my afternoon medications in the car, giving myself an extra 15 minutes to let the fatigue suppressants kick in before facing the family gauntlet. Jessica met me at the door, radiant in a designer dress that probably cost more than my monthly medication copays. "Emma, you made it. Come meet Richard's family. They're so excited to meet everyone." The living room was packed. Extended family clustered in their usual formations. The successful siblings comparing vacation homes, the cousins discussing promotions and bonuses, the aunts and uncles holding court about their various achievements. And there, in the center like a queen on her throne, sat Aunt Marie in casual clothes that somehow still radiated authority. "Emma," she called out, her voice carrying across conversations. "How are you feeling? Still worrying about that heart thing?" Conversations paused. Eyes turned to me. "I'm managing," I said carefully. "That's good. You know, I reviewed your chart again last week. Professional courtesy to your cardiologist. Your ejection fraction is stable on medication. All this talk about transplants and surgery, it's really more optional than urgent. We see truly critical cardiac patients in the ER every day. You're not that." Richard's father, distinguished in an expensive sweater, nodded along. Aunt Marie had been telling him, I realized, that his daughter's cousin was a bit of a hypochondriac. "Marie's been telling us about the really critical cases at Metro," Richard's mother added, her smile sympathetic. "It must be hard for you, dear, dealing with health anxiety. Have you considered therapy?" I felt the familiar flush of humiliation creeping up my neck. Around the room, family members exchanged knowing glances. Poor Emma, always making mountains out of molehills. Actually, a new voice cut through the murmur. I'd be very interested to hear more about Emma's case. A woman I didn't recognize stood near the fireplace, mid-50s, with sharp eyes and an air of quiet authority. She wore a simple dress and a small pin on her lapel, the kind of subtle accessory that meant something to those who knew what to look for. I'm sorry, Jessica said, her hostess' smile firmly in place. I don't think we've met? Dr. Catherine Walsh. I'm Richard's godmother. I flew in from Johns Hopkins this morning. He didn't want to make a fuss. She turned those sharp eyes on me. Emma, is it? Your aunt mentioned you're dealing with a cardiac condition. Aunt Marie straightened, her professional smile activating. Nothing serious. Dilated cardiomyopathy managed medically. Emma tends to catastrophize. In emergency medicine, we learn to distinguish between actual emergencies and anxiety-driven concerns. I see. Dr. Walsh's expression didn't change. And you've reviewed her case personally? I have access to all patient records at Metropolitan. Professional courtesy. Fascinating. Without a release authorization from the patient. The room went very still. Aunt Marie's smile flickered. As the director of emergency services and a family member, I have certain privileges regarding family medical information. To ensure appropriate care. Emma, Dr. Walsh said, turning fully toward me, what's your current ejection fraction? The question hung in the air. Aunt Marie shifted uncomfortably. 22%, I said quietly. Down from 31 6 months ago. Dr. Walsh's eyes narrowed. And you're listed for transplant? Status 2 on UNOS. I've been on the list for 6 months. My transplant coordinator says. Your transplant coordinator, Aunt Marie interrupted with a forced laugh, is being overly cautious. You're stable. The surgery isn't urgent. A 22% ejection fraction, Dr. Walsh said, her voice cutting like a scalpel, is severe heart failure. Status 2 listing means significant limitation of activity. And you're calling this? What was your phrase? Optional. I said the timing is flexible. She's not critical. I direct the cardiac transplant board at Johns Hopkins, Dr. Walsh said, her voice still calm but carrying an edge that could cut glass. I review hundreds of transplant cases annually. An ejection fraction of 22% in a 28-year-old patient represents severe systolic dysfunction. Without transplant, the 5-year survival rate is roughly 50%. That's not optional surgery. That's life-saving intervention. The room had gone completely silent. Richard's father had gone pale. Jessica's smile had frozen on her face. Aunt Marie stood up, her voice taking on the authoritative tone that usually ended family medical discussions. With all due respect, Dr. Walsh, emergency medicine gives me a broader perspective on what constitutes true medical urgency. Emergency medicine, Dr. Walsh interrupted, gives you expertise in acute crisis stabilization. Chronic heart failure management and transplant medicine are entirely different specializations. Specializations you are not trained in. She turned to face the room, her voice carrying to every corner. I need everyone here to understand something clearly. Emma is dying. Slowly but certainly her heart is failing. She has been placed on the national transplant waiting list not as a preventive measure, not as an optional procedure, but because without a new heart she will die. Probably within 5 years. Possibly much sooner if her condition continues to deteriorate. My mother had gone white. Jessica's hand was pressed to her mouth. Furthermore, Dr. Walsh continued, her gaze returning to Aunt Marie, accessing a patient's medical records without proper authorization, even a family member's records, constitutes a serious HIPAA violation. Discussing those records with other family members without the patient's consent? That's grounds for disciplinary action, potential loss of medical license, and possible legal consequences. Aunt Marie sank back into her chair. I was trying to help. To keep Emma from worrying unnecessarily. You were trying to maintain your position as the family's medical authority, Dr. Walsh said, her tone almost gentle now, which somehow made it worse. And in doing so, you violated patient privacy, spread medical misinformation, and minimized a genuinely life-threatening condition. You convinced this family that their daughter, their niece, their cousin was exaggerating a minor health concern when she is, in fact, in heart failure. She pulled out her phone, tapping the screen briefly before looking back at Aunt Marie. I sit on the ethics review board for Metropolitan Hospital. We're having our quarterly meeting next week. I believe your conduct with Emma's medical records warrants immediate investigation. The Thanksgiving feast continued, but the atmosphere had shattered like dropped crystal. Dr. Walsh sat beside me, asking quiet questions about my cardiology team, my symptoms, my transplant coordinator's assessment. Richard's family, far from being the impressed audience my family had hoped to cultivate, looked at Aunt Marie with barely concealed horror. Jessica's engagement announcement happened, but the celebration felt hollow. Her fiancé's family left early, Richard's father making a ethics that left no doubt about his opinion of Aunt Marie's conduct. My mother found me in the kitchen as I was preparing to leave. Emma, I didn't know. Marie said. Marie said what she needed to say to maintain her authority. I said, carefully packing leftover turkey I'd barely touched. And everyone believed her because she has the impressive title and I'm just the quiet one who doesn't make waves. We should have listened. We should have. Her voice broke. I told you. Multiple times. I said I was on the transplant list. I explained my ejection fraction. I gave you my cardiologist's number so you could call and understand. You chose to believe Aunt Marie instead because it was easier than accepting that something was seriously wrong. I left as the sun was setting, the sound of my mother's tears following me to the car. The Metropolitan Hospital ethics investigation moved swiftly. Dr. Walsh's involvement gave it weight, but the evidence was damning on its own. Aunt Marie had accessed my medical records 17 times over the past year without authorization. She discussed my case with multiple staff members, with family, with friends, all violations of patient privacy laws. Her suspension came 3 days after Thanksgiving. The formal investigation letter arrived a week later. By Christmas, she'd resigned rather than face a full medical board review that would likely have resulted in license revocation. My phone buzzed with family messages. Some apologetic, some angry. How dare I ruin Marie's career? Some confused. When had my condition become so serious? A few, very few, genuinely concerned. What could they do to help? I responded to none of them. Instead, I sat in my cardiologist's office, discussing my declining ejection fraction and the possibility of moving to status 1B on the transplant list. Your support system is important, Dr. Morrison said gently. Do you have people who can be with you during this? Family, friends. I thought about Dr. Walsh, who'd called twice to check on me and had connected me with support groups for transplant patients. I thought about my colleagues at the software company who'd quietly arranged for remote work flexibility. I thought about my neighbors who'd started leaving meals at my door after Jessica apparently told half the community what had happened at Thanksgiving. I'm building one, I said. A real one. People who actually listen. My phone buzzed again. Another message from the family group chat, this one from my mother. Family meeting this weekend to discuss how we can support you. Marie won't be there. Please come. We want to do better. I stared at the message for a long moment, then looked at Dr. Morrison. Can I think about it? Of course. But Emma. She leaned forward, her expression serious. You're the one who gets to decide what your family relationships look like going forward. You're the one with the power here. Don't forget that. I drove home as the winter sun set early, turning the sky orange and purple. My heart fluttered irregularly in my chest, the damaged muscle struggling with its basic function. But my phone was full of messages from the transplant support group welcoming me. My email had a note from Dr. Walsh, introducing me to a transplant recipient who lived nearby and wanted to talk. Somewhere out there, maybe tonight, maybe months from now, my donor heart was beating in someone else's chest. When the call came, when the transplant happened, I knew exactly who would be in the waiting room. And it wouldn't be the family who'd called my failing heart optional. It would be the people who'd learned to actually listen. 3 months later, my phone rang at 2 a.m. The transplant coordinator's voice was calm, professional. We have a heart. I made 3 calls from the ambulance. Dr. Walsh answered on the first ring. My neighbor Tom was at the hospital before I came out of pre-op. My coworker Sarah brought a bag of essentials my mother had never thought to ask about. The family group chat exploded with messages when word got out. Demands to know which hospital, which surgeon, why hadn't I told them sooner? I turned off my phone. When I woke up 18 hours later, a new heart beating strong and steady in my chest, the first face I saw was Dr. Walsh's. Behind her stood the people who'd actually shown up. Not with medical opinions or dismissive judgments, but with presence. My mother appeared in the doorway 2 days post-op, tears streaming.